Dr. Simon has a hereditary angioedema HAE patient named Phoebe. Phoebe is a 4th grade teacher who loves Rocky Road ice cream and hiking. During her last appointment with Dr. Simon, he discovered Phoebe was having breakthrough attacks with her prophylactic therapy and needed multiple doses of her acute bradykinin 2 receptor antagonist to treat an attack. Phoebe had a trip planned to the Grand Canyon and wanted to discuss treatment options. Dr. Simon considered a recent HAE lecture he attended, which highlighted newly discovered pathways that could lead to an HAE attack. He illustrated for Phoebe a potential scenario occurring in her body. By starting with the contact activation system, Dr. Simon highlighted that vascular leakage is caused by an overproduction of bradykinin, which binds to the bradykinin B2 receptor. Phoebe is taking a kallikrein inhibitor for prophylaxis to block the production of bradykinin, but occasionally she would still have an attack. Dr. Simon explained to Phoebe there is an alternative lectin pathway in the complement system where MASP1 could be activating bradykinin production by not only cleaving high molecular weight kininogen, but also upregulating the bradykinin B2 receptors, leading to edema. In those instances, he explained to Phoebe, a bradykinin B2 receptor antagonist will compete with bradykinin for a receptor, while her system continues to be flooded with bradykinin. He informed Phoebe this could be the reason she requires redosing to control an attack. To address the issue, Dr. Simon suggested Phoebe continue to take her kallikrein inhibitor for prophylaxis, but try a high-dose C1 inhibitor as an acute treatment for her attacks. By replacing C1-INH, it inhibits MASP1 and kallikrein from cleaving HK and producing bradykinin. Dr. Simon thought Ruconest, C1 esterase inhibitor recombinant, could help because in clinical trials, it was shown to stop 97% of attacks with just 1 dose. The most common side effects were headache, nausea, and diarrhea. Utilizing the Ruconest Solutions Starter RX program, the specialty pharmacy shipped Phoebe 4 vials of Ruconest, while she and Dr. Simon waited for her coverage to be verified. She was trained by a healthcare professional and self-administered her first IV injection of Ruconest. She sent Dr. Simon pictures of her trip to the Grand Canyon. School starts in 1 week, and Phoebe will take Ruconest to school with her, along with her lunch, just in case she has an attack. Indication: Ruconest is indicated for the treatment of acute attacks in adult and adolescent patients with hereditary angioedema, HAE. Effectiveness in clinical studies was not established in HAE patients with laryngeal attacks. Important safety information: Ruconest is contraindicated in patients with a history of allergy to rabbits or rabbit-derived products, and for patients with a history of life-threatening immediate hypersensitivity reactions, including anaphylaxis to C1 esterase inhibitor, C1-INH preparations. Monitor patients for early signs of allergic or hypersensitivity reactions, including hives, generalized urticaria, tightness of the chest, wheezing, hypotension, and/or anaphylaxis. Should symptoms occur, discontinue Ruconest and administer appropriate treatment. Serious arterial and venous thromboembolic TE events have been reported at the recommended dose of plasma-derived C1-INH products. Risk factors may include the presence of an indwelling venous catheter access device, prior history of thrombosis, underlying atherosclerosis, use of oral contraceptives, or certain androgens, morbid obesity, and immobility. Monitor patients with known risk factors for TE events during and after Ruconest administration. Appropriately trained patients may self-administer Ruconest upon recognition of an HAE attack. Advise patients to seek medical attention if progress of any attack makes them unable to properly prepare or administer a dose of Ruconest. The serious adverse reaction reported in clinical trials was anaphylaxis. The most common adverse reactions, incidence greater than or equal to 2%, were headache, nausea, and diarrhea. Before prescribing Ruconest, please read the full accompanying prescribing information.